Hello, I'm Alison Beal. I'm one of the heart failure specialist nurses here at Kingsmill. Unfortunately, heart failure it just means a lot of things to different people, but basically it's just a reflection of the heart is not doing its job properly, and that's the kind of thing that we put across to patients in terms of supporting them and giving them the education they need to help self-manage. Well, our service started in 2002, and it was just me as a heart failure nurse. We set up the service, and it was very much an inpatient and outreach service. So I saw patients on the wards, and then I would actually do home visits when the patient got discharged. As time went on, it was identified that just managing heart failure is just one side of cardiology that can be supported and by specialist nurses. We identified a gap in the service for those patients with chest pain and certainly with arrhythmia. So then we put a business case together, and we're successful to help develop cardiology and to help support the patients in that way. Our service takes referrals from inpatient and outpatient services. So a patient may be admitted with heart failure and they'll ask us to see them, and we look at the medication, we look at devise a treatment plan for them and provide the education to the patient with the ultimate goal of getting them home stable and with the right kind of support to self-manage that condition going forward. So we see patients on the wards as inpatients, either EAU or other medical wards, even surgical wards. And then our other referral route is from outpatient clinics, the consultants perhaps seeing a patient in clinic and asking us to get involved.
Hello, my name's Holly and I'm one of the chest pain specialist nurses. The cardiology has always been my passion, so I qualified 4 years ago, started on Ward 23 and worked there for 2 years and loved it. Moved to Ward 24 as a deputy sister, which was cardiology and haematology, and whilst I loved the ward, haematology was just not my bag. I always preferred cardiology, and when the secondment came up for this job, it was too good of an opportunity to miss. Okay, so me and my colleague Helen, we cover EAU between us every morning, so we go down and see anybody who's coming overnight with chest pain and needs a cardiology review, and we see them before the cardiologist gets there. And try and make a plan for them. We also cover rapid access chest pain clinics and the ACS clinics, and help with some of the stress tests involved with the heart. So an ACS clinic is for people who have had an angiogram and had a stent, or have had an angiogram and they've got disease that we know about. So sometimes they come and they've had a stent and they feel fine and we can discharge them, and other times they come and we need to tweak the medication or send them for further testing to help with their condition.
I'm Nikki Williams, I'm the arrhythmia specialist nurse here at Kingsmill. I've been in post full-time for a year now. The arrhythmia post was a relatively new position when I came into it, so I've built up my patient caseload. I see patients with irregular heart rhythms and work with them to control their symptoms and try and regulate that heart rhythm and heart rate. I look after people who are at risk of sudden cardiac death because of dangerous heart rhythms and provide counselling for them living with those conditions, provide education for the potential management and treatment strategies that we have for that, and patients who have certain types of pacemakers or implantable defibrillators, I look after those as well. So I'm really passionate about building a relationship with the patient, a partnership with the patient, and I've found that being quite new to the arrhythmia specialist nurse role, I've found that having a partnership with the patient gets better results. The patients buy into their care a little bit more, and they will have an overall better understanding if we can really meet them at the level they require to get some understanding and some empowerment for them.